We'll be talking about increased loss of iron as a cause of what? Iron deficiency anemia. Okay. So understanding this lecture from the first principle is like, okay, um, the blood contains what? Hemoglobin. Hemoglobin is made up of what? The globin chains and the iron. Okay. So as you are losing blood, you are losing hemoglobin, you are losing iron. Okay. So if you are losing blood on the increase, then it can lead to what? Iron deficiency. It can lead to low levels of iron in the body because the biggest storage for iron is what? The hem. Hem is found in hemoglobin. Hemoglobin is found in what? Blood. That's the red blood cells. Okay, so let's move, guys. Let's talk about increased loss of iron as a cause of iron deficiency anemia. Okay, you can see this blood loss during menstruation, internal bleeding, anything that has to do with what? Blood loss. Okay, it basically lead to iron deficiency anemia. So let's talk about it. Let's talk about all the factors we can have here. We can have the gastrointestinal blood loss, and this can be seen in men and postmenopausal women from gastric or colorectal malignancy. Okay. And other conditions like what? Gastritis, peptic ulcer, inflammatory bowel disease, diverticulitis, polyps, angiodysplasia. So all these conditions just have to do with inflammation affecting the blood vessels in that area, so you are actually losing blood. All right. Then you can also lose blood from parasites infections like hookworm and schistosomiasis are the most common parasites, okay, that can basically make you lose blood worldwide. All right. Then you can also still lose blood from drug treatments, like when you are having some treatment from like aspirin, because aspirin will stop, basically will be acting against blood coagulation. So you have much more blood in the liquid state, so you can easily just lose blood. Then the non-steroidal anti-inflammatory drugs too. Then menstrual loss and breastfeeding. All right, menstrual loss and breastfeeding, like I already said here, blood loss due to menstruation, and women do lose this thing monthly. Okay, so now chronic hemoptysis and hematuria. All right, all this can also lead to what? Loss of iron. Now let's talk about the symptoms of this iron deficiency. It's not part of this lecture, but since we got this slide here, let's just talk about it. It will lead to what? A broken hair or hair loss. It will lead to what? Cracked lips and torn corners of the mouth. That's angular stomatitis or angular cheilitis. Mucosal changes and a burning tongue. That's glossitis. Then it can lead to heartburn, anorexia, gastrointestinal complaints. It can lead to a pale skin or dry skin or feeling cold. It can lead to fatigue, headache, lack of concentration. It can lead to what? Anemia, immunodeficiency, inefficiency. Immunodeficiency like a weak immune system. Then you have ached and brittle fingernails. That's what? Koilonychia. That's what they call cholinecia. So that's it about talking about increased loss of iron as a cause of iron deficiency anemia. See you guys pretty soon.